Good morning. Welcome into a business spotlight on this Friday morning featuring Morris Hospital and Healthcare Centers. And I'm joined once again by Dr. John Bolden, an infection disease physician who's been on Morris Hospital's medical staff since 2005. He serves as chairman of the hospital's Infection Control Committee. And in July, Dr. Bolden joined Morris Hospital's Healthcare Center network and sees patients at the Morris Hospital Healthcare Center of Morris Hospital at 151 West High Street in Morris. Good morning, Dr. Bolden.
Hey, how you doing, Kevin?
Doing well. Great to have you in this morning. On our last visit, we talked about just what exactly an infectious disease physician does. And today we're going to focus in on one of the ailments or diseases that you treat, and that being West Nile virus. What is West Nile virus, Doc?
West Nile virus is a mosquito-transmitted virus. Basically, the mosquito feeds on an infected bird which has the virus, and then by the mosquito biting and sucking the blood from the bird, the virus tends to multiply in the mosquito, and then if the mosquito bites a human, and that can transmit infected mosquitoes' blood into the human blood, and the virus can then multiply and really cause the disease, such as West Nile virus.
All right. Well, now, what are some signs and symptoms of West Nile virus?
That's a good question. There's 4 symptoms that we tend to see with West Nile. There's headaches. There's also myalgias, can be muscle aches, there's fever, and then also in more severe cases, you can have some neck pain and also sort of then delirium of some mental status change with that.
So almost kind of like maybe like cold or flu-like symptoms, huh?
Exactly. Yes.
All
yes.
right. When do we see most West Nile virus cases occur?
It tend to occur in the summer and the fall, usually between June and September. Tend to see a rise in those cases.
Sure. Is there any person more susceptible to one over the other to acquire West Nile virus?
Yeah, we tend to see it more in elderly patients. The immune system tends not to be as strong. I also see it in bone and organ transplant patients, because before the screening for bone and organ transplants, there was some few cases where West Nile was transmitted through bone and organ transplants. So, but now the testing is a lot better than it was previously. It's more stringent. And then in addition to that, people who tend to have work outdoors more could get it, such as a landscaper, a gardener, even farmer, too,
Sure.
because being exposed to mosquitoes and possibly not wearing a long sleeve shirt and pants, which tends to decrease the risk of getting the virus.
Are there ways to prevent it?
Yeah, so there's several ways to help decrease the risk. You can use insect repellent with the substance capital DEET, they call it DEET. Also, there's a substance called picaridin, and also oil of lemon eucalyptus, but you tend to not give it to babies less than 3 months of age,
Okay.
So there's also other tips. As I mentioned, wearing long sleeve shirts, pants, also housing wise, making sure your screens, there's no holes in the screens. Also not keeping the doors open at the house. Also standing water, emptying pots, garbage cans that could have standing water where mosquitoes tend to breed. Garbage, not leaving it out where it tends to attract mosquitoes too.
Sure. Now, does can having West Nile or a serious West Nile infection, can it lead to death?
It can, but it's very rare.
Okay.
Our statistics is about 1 out of 150 tends to lead to death with more severe neurological cases. Usually, out of the West Niles, that end up neural is about 1 out of 25 to 50.
Okay. And are you seeing a lot of West Nile virus?
This year, so far, it's been about a little below average. I mean, there have been positive West Nile tests in Will County.
Right.
Grundy, I think, a few too, with some of the mosquito sample batches. But I haven't been aware of any confirmed deaths caused by West Nile.
Right. Okay. Very good. Now, if folks would like a consultation from you, how do they reach you?
You can call my office, area code 815-513-3074. Again, 815-513-3074.
All right. Very good. Well, hey, Dr. Bolden, as always, thanks for being here.
Thanks a lot,
Appreciate you
Kevin.
coming in.
Appreciate it.
Have a good weekend.
Okay, you too, Kevin.